Valvular heart disease is fairly common in our clinical practice. If you look at the profile of valvular heart disease, a couple of decades ago, predominant cause of valvular heart disease was rheumatic heart disease, where a childhood rheumatic fever leads to scarring of the heart valves, especially the mitral and the aortic valves, and with advancing age, the patients present to us with problems with those valves. But by and large, now with an active rheumatic heart disease prophylaxis program, we see a declining trend or declining incidence of rheumatic heart disease, and we are seeing more cases of degenerative valvular heart disease. Basically, degenerative valvular heart disease is a manifestation of degeneration or aging process that occurs in the heart valves, the mitral valve as well as the aortic valve. And this with the increasing longevity and increasing health standards, as people are living longer, you see more incidence of degenerative valvular heart disease. More often, the degenerative process affects the aortic valve. It's called degenerative aortic valve stenosis, and it is usually seen in the elderly. In a small subset of people, this is congenital. It is present from birth. Normally, the aortic valve is tricuspid. It has got 3 leaflets, but in some people, by birth, it is either bicuspid or monocuspid. So these valves are prone for more wear and tear with age, and therefore they present with valvular heart disease affecting the aortic valve. That is called bicuspid aortic valve disease. That is a small subset of our patients, but predominantly when we speak of valve disease in the adults, it is largely degenerative valve disease.